is substance use prevention important?
Substance use prevention should always be the most primary sensible approach, yet in most cases it still could benefit from a lot more advocacy to prioritize its importance within the spectrum of other health responses to drugs. Now, mobilizing resources for prevention should stop being seen as a liability. Not investing in prevention is not a choice. It does come at a cost. However, of course, not everything called prevention is prevention. A reference here is for prevention that really is in line with standards and is in line with the science. Broadly, it is investing in strategies that target individuals who have not yet started using substances, some of which may be considering using it, with the aim of either preventing initiation or at the very least delay its onset until later in the developmental age of the children brain. The reasoning being that the majority of the target beneficiary population of substance use prevention are children, there are adolescents, and young adults. Drug prevention refers to strategies, to programs, to practices that are designed to mitigate the various harms associated with drug use by preventing its initiation to start with. Drug prevention at its core, however, is investing in these people and their safe and healthy development. So, initiation of substance use is the result of a set of unaddressed vulnerabilities that include individual characteristics, may it be reactivity to stress, mental health, personality traits, neurological development, and more. And how these interact with micro-level influences, such as those within the family, from neglect to conflict, to abuse, to negative role modeling, to the schools, from quality education to the school climate, to health education, and more within the school, and of course the peers. But these individual and micro-level influences are not in vacuum, and they can be affected by larger macro-level influences such as violence at the community level, conflict, displacement, social inequalities, and more. So, of course, such individual and environmental influences carry different impact and need to be addressed differentially at different ages of development, from birth and going onwards. What is important is that these vulnerabilities are not unique to substance use, but are also common to violence, to mental health, to school delinquency, to school dropout, and more. So prevention in this context as well carries a developmental connotation. It is addressing the vulnerabilities and strengthening the protective factors supporting achieving intellectual, cognitive, emotional, social competencies needed for a safe social and healthy development at different ages. So drug prevention is grounded in research. It should be involving many stakeholders collaborating with each other, such as healthcare professionals, educators, community leaders, policymakers, to create that in these environments that support healthy choices and behaviors in children. So in essence, drug prevention importance comes from being a foundational strategy for promoting individual and public health, economic, social well-being. It is intimately linked to multiple sustainable development goals.